Coronavirus infections continuing to soar. The state reporting more than 2,800 new COVID-19 cases yesterday. That's the fifth highest total. But the number of people needing hospital care has hit a new record. Health officials reporting more than 100 new hospital patients just yesterday. The rise leaving many worried about a strain on our frontline workers. We spoke with a doctor who says hospitals know more today about the virus, which is allowing them to give patients better care. Mara Siriani has more.
Consider this a lesson learned. As doctors' understanding of the virus has evolved, so too has the standard of care. Hospitalizations are up 43% today from May 1st. That's according to data released by the state. Back then, 1,500 patients occupied beds compared to the 2,322 patients today.
Good news is, so far, the trend has been more medical surgical admissions than ICU admissions.
The main difference, unlike the beginning of the pandemic, doctors and state health officials have more developed plans in place to deal with the increase in patients. They also have treatments. First is convalescent plasma, donated from recovered patients with the goal of passing on COVID-19 antibodies to current patients. The second is the drug remdesivir.
And has been shown in some studies to reduce the duration of symptoms, which in kind means reduced hospitalization.
As the number of patients in Georgia hospitals continues to trend upwards, doctors believe that a wave of patients connected to the 4th of July weekend could be on the way.
And now the leading Emory epidemiologist Carlos Del Rio is working to fight misinformation amid COVID. Nick Sturdivant is live in Midtown. And Nick, Dr. Del Rio doing a little myth busting for us.
Yeah, that's right, Sheba. Good morning. And there's a lot of information out there, especially once it hits social media, which gets shared thousands of times. Dr. Del Rio did point out that Georgia is nearing a breaking point, predicting that ICUs and emergency rooms will be overrun with COVID patients by next week, and says now is the time to stop the spread of the virus. He says when people compare COVID-19 to the seasonal flu, they're just wrong. He says the data is very, very clear. COVID is 20 times deadlier than the flu. One of the most harmful myths he thinks contributes to the spread is that wearing a mask is harmful. There's a graphic that's gone viral online that Dr. Del Rio says it's just not true.
If you believe this, you should, next time you have a surgery, tell your surgeon, please don't wear a mask because I don't want you to fall asleep in the operating table or do something wrong as a result of this. I mean, this does not happen. This is made up science. This is not a reality. People are really wanting to go back to school. People are really wanting to go back to sports. People are really wanting to get back to normal. If we don't stop transmission of the virus, we're not going to get back to normal. So forget about your CO2 retention. Forget about all those conspiracy theories.
And Sheba, Dr. Del Rio believes that a lot of the misinformation that's out there is based on fear.